Almost there. We have one more discussion by a long-term survivor, Marissa, who has had quite a journey that, and she's going to tell you about some of those things.
Oh, man. Are you guys still awake with me? Barely. I'm so honored to be here today among this room full of people who have dedicated so much time and their lives to what I have experienced and currently experience. And so first of all, I just want to say personally from me, thank you so much for your work, because it is making a difference. And it's so exciting to see all of you come together, and not gonna lie, a lot of the stuff went over my head, but just to see you bring your expertise and everyone collaborate is really, really neat. And while I don't have fancy research and fancy graphs, and I don't know much about the intricacies of T-cell therapy, I do know what this is like. I know the numbness that just comes over you when you're diagnosed with cancer. I know the helplessness of being thrown into a world that you know nothing about, that suddenly you are forced into. I know the bittersweet nature of going into treatment and having this thing put in you that is helping cure you, that is helping, working to heal you, that you're so grateful that it exists, but it's poisoning you, it's making you suffer, and it's so confusing. A little bit about, there we go, my story. I was diagnosed with Hodgkin's lymphoma when I was 13 years old after about a 5-month search to find out what was wrong. And that's something, I don't have the time, but that's something I could definitely go on about for a while, is how they aren't looking for cancer in kids. And so many children whose stories I've heard are diagnosed so late. And thankfully, finally we found out December 18th, 2007, that the mass in my chest was Hodgkin's lymphoma. And it was an urgent situation in the sense that it was wrapping around my windpipe and constricting my blood flow a lot. And so it was an urgent situation to get me into treatment, to get it shrunken so I could continue to breathe and have circulation. And so I went into treatment, and I had 4 rounds of chemotherapy, and I had, following that, I had 3 weeks of daily radiation. And during that time, obviously, it was one of the toughest, scariest experience that I've ever had. But amidst that, of course, there were those beautiful moments that can only come out of tragedy that were really cool to experience. And that's the eternal optimist in me speaking. And this is me. Like I said, I have no fancy graphs. This is me on my last day of chemo. And I finished my treatment. It was May 8th, 2008. I finished my last radiation treatment. And somehow I danced in a show 2 days later. And we had this big barbecue, invited all the family and friends over. My doctors and nurses were there. And it was a celebration. Melinda's done with treatment. She's done. And I think this is what survivorship looks like to a lot of people, is, yay, no more cancer, looking forward into the future. Here you go. You have your whole life ahead of you. You have this new perspective and passion for life. Go for it. Let's go. What I found to be survivorship was lying on the couch, not having the end of treatment anymore as my goal, and struggling, still feeling horrible, and not knowing when it was going to end. And it was so strange thinking, okay, I'm done, and knowing that, okay, I'm done, but what does that really mean? And I just was left wondering how long I would have to wait. And I wasn't informed really of what to look for. as far as physical issues or any other issues. And it just became this waiting game of, are these symptoms going to go away in months, years? Are some never going to go away? And this is, obviously I love dance. This is me in my survivorship phase right after treatment. And I had severe digestive problems due to my treatment, and it was very, very difficult for me to eat. And then I developed an emotional hatred of food. And also at the time, when you're going through treatment, you can't deal with all of the emotions that involves. It's just moment by moment, okay, they need to access my port, okay, let's do that. I got to the point where I was just so numb physically, they could have jammed 100 needles in me and I just would have been fine. And so you just become numb, and then afterwards, you start to go, whoa, what did I just go through? What just happened? And so dealing with all those emotions as well contributed to this eating disorder as well. Before and after. And so something that came about was just with time and also with counseling, I was able to recover emotionally and gain strength mentally and physically and emotionally concerning the eating disorder and the digestive problems, thankfully. And one interesting thing that I want to add is that I was able to get the counseling that I received because solely because of a private foundation that was able to help us out, help my family out so that I could receive those services. And that truly saved my life. I got down to 79 pounds at one point. And so that was a very life-threatening time. And so I talked about I was just left waiting, and I didn't know how long that I had to wait for. And now I'm a junior at Pepperdine University, and obviously I love dancing. I'm bald in this picture because I shaved my head for St. Baldrick's a couple of years back. And so I have all these things that I love to do, and I do have a incredible perspective that the experience has given me. But in so many ways, I'm still waiting. I know that chronic fatigue was something that was talked about a lot, and that is one of the main things. I don't think there's been a moment in 7 years where I haven't been tired, if I'm being completely honest. A lot of confusion, mental fog, things like that I don't think were ever really addressed as far as things that could be possible concerns in the future. And I wanted to say that I have this wonderful, incredible life that I get to live now, and I'm so humbled when I hear stories from parents who have lost their kids, because who am I to be standing here? And I know we can dive into the science and the medical reasons of statistically why I am here, but I'm just so humbled because that could easily be me. And I just want those parents to know that I feel a certain responsibility as a survivor to continue to live for their kids because they could not. So really what I'm hoping from all of this is less toxic treatments for kids. The intensity of the treatment I received, it was gnarly. It was really intense. And really, after treatment, I was just thrown into the world. And I didn't know about, really today I've been so educated on how at risk I am for breast cancer now. And that's just today. And so I think there's such a lack of education and knowledge being distributed to survivors. And I think everyone is different, but I'm a true believer that knowledge is power, and it can empower survivors in the sense of, okay, I'm done with treatment and I made it. I'm a survivor now, and I can have that passion and I can be joyful about that. But at the same time, I don't have to let the cancer define me, but at the same time, I can know these things and understand what my life is like now and what to look out for. Going into the doctor now is a very interesting thing, because they say, what is your health history? And I go, oh gosh, like, do you want me to go get the file that's like that big? But often, I say, oh, I'm a cancer survivor, and most often their response is, congratulations, and that's it. And there's not a consideration of that fact. And my hope is that so many wonderful opportunities have come from my cancer experience. I'm a believer that everything happens for a reason. And so I'm very grateful for what the positive things that have come from it. And I want other survivors to be able to experience life after cancer, and to be able to pursue their passions and pursue life with that new perspective without a cost of the cure. I'm not going to lie, there have been moments where I have wondered if I knew when I was lying in the bed, if I knew what quality of life was like for cancer survivors, would I have fought so hard? And would I have had the same hope? But then there are moments like this where I get the opportunity to look at another childhood cancer patient and go, hey, I'm healthy now. Healthy, put that in quotes. But I made it through this, and you can do it too. And there are those moments where it's like, okay, I'm so happy. But that's why I'm so excited, all the things you talked about today, because I can really see things moving forward for the care for childhood cancer patients during treatment and then after treatment. So thank you again for all your work, and thank you for the honor of being here. Appreciate it.